You know, it used to be that being in a union guaranteed health and economic security, and I think we all know that that's not as true as it used to be anymore. And I think, but that's only part of the reason we're here today, because we are the union, and this is what we care about, and this is what we're about. And this is what we want to tell our legislators today, and we want them to be with us. And it's a proud day to have all these people standing up here with us today. At this point, I'm going to introduce Judy Thomas and Ruby Riley from the Plainfield Board of Ed. They are also members of CSEA Local 2001.
Hello, my name is Ruby Riley. I work for the Plainfield Board of Education. Right now, they do not offer us health insurance. I work 2 jobs, and neither one of my jobs offer me health insurance. We have 51 drivers for the Plainfield Board of Ed, and only 10 drivers are covered while the rest of us have to suffer. We are pushing in our negotiation contract that they offer us health insurance, which we know we're going to get denied. I myself I had Husky at one point, but was booted off because I supposedly make too much money working as a bus driver. So I pay for my son, but right now I am not covered at all. And hopefully nothing happens to me between now and then, because I am the union president for our local in Plainfield. This is Judy, my coworker.
Hi, Judy Thomas. I've been driving school bus for the town of Plainfield for approximately a year and a half. According to the handbook that they pass out, we have to be on the job as part-time drivers for at least 5 years before we are eligible to get insurance through the town. And then it adds a cost of excess of $600 a month. Who can afford that? My husband has been certified disabled. He has severe COPD. He has to wait 2 years before he can get coverage under Medicare. His inhalers alone cost hundreds of dollars a month. How is anybody supposed to afford this on a fixed income and a part-time income? And I cannot work full-time because he needs so much care at home. What are we to do?
Universal health care.
Going back some years, the Connecticut AFL-CIO and the AFL-CIO supported health care. In Connecticut, we supported a single-payer system going back over 10 years ago. It was kind of controversial because there's some discussions at the national level. But I'll tell you right here, today we reaffirmed that at the AFL-CIO convention because of your leadership that we are for a single-payer system here in Connecticut. And you know, the cost. You know, they talk about cost, but the thing is that the cost of not doing it is costing us too much. This is a moral issue. It's criminal. People who provide health care have to fight with their employers over health care. Something's wrong with the system. Now you're here today to hold people accountable. You know, we come up with conventions, all of us. We all have our process. We endorse legislators. There's 100 legislators that are on record, and they said that they're for universal health care. And you know what that means to me? That means a single payer, let's get it done. And I'll tell you, don't let anybody tell you we can't do it. We'll get it done with you